What's up, my dudes and dudettes? Welcome back to the third space. Phil and Alex here.
The usual, we haven't made an episode in a while, but we're back here for something a bit interesting.
Yeah, today we're not talking about the status quo. We're gonna be talking about something absolutely unrelated, so because life should go on.
Honestly, completely different. COVID-19 has overstayed its welcome, so we're gonna talk about other stuff.
Okay, enjoy the episode, guys.
Enjoy. Okay, sorry about the suspense, but today we're talking about miscarriages. Now, motherhood is at the core of most women, and most women want to be mothers whenever they're ready, whether it be emotionally or financially. But for some reason, they don't talk about miscarriages, and miscarriages are one of the most common things to ever happen during pregnancies.
The statistics show that miscarriages happen in about 10 to 25% of all pregnancies. So that means of all pregnancies to occur, around 1 in every 10 pregnancies will end in a miscarriage at best, and at worst, 1 in every 4 pregnancies end in a miscarriage.
Exactly. And in Africa, it's estimated that at least 4.2 million pregnancies per year end up in miscarriages. That is an astounding number. But in Namibia, we don't really know what the numbers are like because we don't have in-depth research done on the topic.
But if you take our word for it, in our very short careers, me and Alex have seen over 200 miscarriages combined.
Imagine, that's crazy, and it's just between the two of us, and we aren't even obstetricians or gynecologists at all. But that's our point, it's very, very common. The take-home message from this video is, 1, miscarriages are common and they recur a lot. 2, the causes for miscarriage are quite numerous and you have to investigate them. And 3, a miscarriage can happen, it's not your fault.
Okay, so what is a miscarriage?
So medically, a miscarriage is determined as the loss of a pregnancy before the age of viability. Now, what I mean by this is the loss of a baby or a fetus before it is able to live outside of the womb, in the outside world, that is. What do I mean by the age of viability?
So, by definition, the age of viability, as you said, means the baby being able to survive. But also, this is very context specific and it depends on where you find yourself in the world.
Yeah.
So, in much more advanced countries, the age of viability may be lower. But say, for instance, like in Namibia, the age of viability in the central areas where we have more specialized medical care, the age of viability is around 26 weeks, which is plus minus 6.5 months. Whereas in the peripheries and the district hospitals, the age of viability is 7 months, which is around 28 weeks.
Yeah. In a nutshell, the more technologically advanced the society is, the lower the age of viability, because they can probably help the smaller babies survive. But that being said, we have 2 types of miscarriages. We have spontaneous and induced miscarriages. We will not be talking about induced miscarriages today, that's a topic for another day. We will, however, be talking about the spontaneous miscarriages, meaning the unwanted loss of a pregnancy.
Now, a side note, we need to note that medically, a miscarriage and abortion essentially mean the same thing.
Yeah.
However, in society, the term abortion tends to have a more of a negative connotation because it implies the forceful removal of pregnancy.
Yeah.
But however, at the end of the day, if you think about it, both these mean they result in the same thing.
Yeah.
So we essentially look at it this way, in that in medicine we even go as far as to call miscarriage a spontaneous abortion. Okay, so it is also important to note that in Namibia, forceful termination, whether you choose to call it a miscarriage or an abortion, is illegal and...
Yeah, that's the law as it stands right now, but do with that what you may. Alright, let's talk about a few risk factors for miscarriages. As we mentioned in the beginning, these are numerous and you can Google most of them. We're only going to talk about a few of these. Now, it's also important to remember that pregnancy usually lasts about 9 months, give or take, and we divide these into trimesters. Why do we do this?
Because the first trimester, a very important process called organogenesis happens. So basically during this period of organogenesis, when organ systems are start developing. This includes your liver, your brain, etc., etc. So any fault during the process of organogenesis results in a mutation, in a defective fetus, and then the body automatically gets rid of this, and then you have a miscarriage.
Exactly. So like you said, this is why a fetus's genetic makeup is pretty important. Now, alcohol and smoking are discouraged in pregnancy for a specific reason, and this is it. They cause mutations or chromosomal changes in fetuses that can lead to problems during this organogenesis, meaning the baby could develop with a really messed up heart or a really deformed lung, for example. And automatically when the body picks this up, it eventually comes out as a miscarriage. Other environmental risk factors like radiation radiation from a phone or an X-ray, for example, it just takes a single ray of the radiation to cause a genetic mutation and therefore leads to a miscarriage. And that, unfortunately, is why first trimester pregnancies are so common.
Yeah, but we're not worried about alcohol anymore.
Yeah.
Thank you, Mr. President.
It's prohibited.
So sometimes a miscarriage occurs as the inability of the womb and associated organs, the inability to carry a pregnancy through to term. So sometimes you can have deformities of the uterus, therefore the baby cannot be accommodated in the uterus. Sometimes there's a problem with the opening of the womb, which is called the cervix, that is incompetent, and these pregnancy losses occur more so in the second and third trimester. And then sometimes you just have the spontaneous growths in the wall of the uterus, which are called fibroids. And then this may also cause the environment in the uterus unfavorable for pregnancy, and you get a pregnancy loss.
Yeah. Other risk factors include things as increased maternal age. This is usually from the age of 35 going upwards. Twin pregnancies or multiple pregnancies can be also a risk factor for miscarriage. Other things include infections during pregnancy, which can lead to miscarriages. Also, you've got autoimmune diseases like diabetes and antiphospholipid syndrome. They're multiple, so you can look them up.
Look those up. So we usually don't investigate pregnancy losses since they are so common.
Yeah.
But however, if you do want to find out, then a consult to your doctor is very much advised.
Yeah, back on that is, again, if you've had 3 or more miscarriages, that usually is a cause for concern in the medical field. So it's always important to remember that if this has happened to you, try to visit your doctor for a pre-conception sort of consult, right? Basically, before your next pregnancy, try to speak to a doctor or a medical professional as to what to do, at least to prevent another miscarriage for the next time, or to at least find out why it is that you had 3 consecutive miscarriages in a row.
It is unfortunate that sometimes women can have a miscarriage without even noticing that they're having one. So, which is why, if it's anything that you take from this video, is that bleeding during pregnancy is abnormal and you should come to the hospital. I mean, there are instances where it can be waited out for a bit, such as in the cases of implantation bleed. However, this should be at the discretion of your doctor.
Yeah, this is why signs that you may be having a miscarriage include vaginal bleeding. Whether it's severe or just spotting, come to the hospital immediately. Others include lower back pain as well as lower abdominal pain, so please just come to the hospital, especially if you notice vaginal bleeding.
See, when the fetus dies, it has to be expelled, including other organs associated with pregnancy, such as the placenta. Because if these are not expelled, then they become a foci for infection.
Yeah, and fever, night sweats, chills, lower abdominal pain that's increasing in severity, as well as a foul vaginal smell are important signs of a severe infection that might have happened during pregnancy, and this is because of the miscarriage. This is why it's important for you to come to the hospital immediately. As soon as you notice even just a bit of vaginal bleeding during your pregnancy, come so we can check you out.
Unfortunately, I feel like I'm the bearer of bad news today, but unfortunately, there isn't much we can do for most miscarriages, because by the time the person presents to the hospital, the process is way too far advanced, and also because more so we start talking about things such as prenatal counseling, where people do not come in and their risk factors for miscarriage or poor pregnancy outcomes are not identified and dealt with before pregnancy, therefore they tend to fall victim to
and it's because we understand how sensitive this topic is that we bring you the information the way it is. Unfortunately, in medicine, there isn't much we can do for the miscarriage if it's already started happening. But our focus is usually geared towards preventing the next one. So we try to study your risk factors, we try to find out exactly what caused the current miscarriage so we can prevent the next one. Now that being said, it also depends on who you are and individual specific. So if you've had an incompetent cervix, for example, like Phil mentioned, we can catch it early enough and by putting a McDonald stitch, which closes up the cervix, which is the opening for the uterus, to allow the baby time to grow and therefore prevent the miscarriage. Or if you've had fibroids, we can offer you an operation where we can cut the fibroid out for the next pregnancy. That way the baby has more room to grow, for example. And that is all we can offer, but that again depends on what your specific cause was. Depending on the cause, we can treat it or we can try to prevent the next one, but again, individual specific.
So once we come to the hospital with an ongoing miscarriage, we do a sonar and see how many or how much of the products of conception are still retained. And with this, we use this information to either decide to go medical removal or watch and wait.
Yeah, and there's also a surgical option where we manually remove these things. And again, this is because they need to come out, otherwise you'll get an infection later on. So that's about all we do for treatment of miscarriages. So, in conclusion, I'm going to go back to one of the 3 points that I mentioned earlier. It's not your fault. Pregnancy losses happen, and it's common for someone to feel at fault or to blame for it. But honestly, miscarriages are some of the common things to happen in most pregnancies. If you speak to some people who have had 7 kids or 8 kids, they'll tell you at least one of their pregnancies was a miscarriage. So it's not your fault, and we should move away from trying to blame women and focus the shift more on trying to prevent the next miscarriage from happening. That is at least what we're trying to do in medicine, and that's how we should move on as a society. We should try to form at least support groups for people who have suffered or are suffering from emotional damage because of this, because it really is an emotional state that these people are put in. So we should really try to not put blame on the women.
Okay, guys, we hope we managed to teach you a thing or two about abortions and open your mind up a little bit on the issue of pregnancy losses. If there's anything you'd like to discuss, hit us in the comment section below. If there's any private questions you'd like to ask us, you can hit us in the DMs at _, and we'll answer you to the best of our abilities.
Yeah, and guys, please, if you like what we're doing, just hit the subscribe button and share with anybody who does like what we do as well. We're trying to get to at least 1K by the end of June, 1K subscribers that is. So like, share, support, comment, subscribe, the usual stuff. So we'll hope to catch you in the next one.
We out!